Hi, how you going? Today I just wanted to run you through a really common question that I get asked is what actually happens in a pelvic floor assessment? How do you actually assess my pelvic floor and what should I expect when I'm coming in to have my pelvic floor assessed? So firstly, we obviously take you through an extensive subjective history where we're asking you about your bladder and your bowel function, your sexual health, babies, any concerns that you may have in terms of pain or in terms of heaviness or difficulty with exercise. Then, secondly, based around what we're finding in the subjective exam is, and what your concerns are, is then what do we actually assess objectively. So, first and foremost, we take you through how to actually breathe effectively, because breathing forms the basis of a really, really strong and healthy pelvic floor and deep motion system, which includes your core. So to teach you to breathe effectively, we typically get an abdominal ultrasound machine. If you're pregnant and you're not comfortable with us using the abdominal ultrasound, that's completely fine. It is completely healthy though to have an abdominal ultrasound for this case, for this purpose when you're pregnant. So what we actually do is we pop the abdominal ultrasound with a little bit of gel on the lower part of your tummy, and you're watching a screen, and we actually show you where your bladder is. There's a tissue underneath your bladder on the screen, and that's your pelvic floor. So we show you actually what's happening with your breathing and how that's related to your pelvic floor health. And we show you some really, really effective techniques to breathe more effectively. Then in terms of an actual pelvic floor assessment, we run you through why we're wanting to assess your pelvic floor, and ultimately this is because having an internal examination, which is typically just a one-finger examination and a squeeze pressure test essentially, so you're just squeezing around one finger internally within the vagina. That gives us the best indication of any laxity or any issue with the tissue within your pelvic floor and within the vaginal wall. Secondly, it also gives us a really good indication of how effective your pelvic floor actually can activate, and that includes not only your strength but also your endurance capacity. So can you actually actively contract your pelvic floor and hold that contraction while you breathe or while you do things on top of that contraction? We're very understanding and we're very empathetic in this clinic, considering it's a very delicate and personal world, the pelvic floor world. So we're very relaxed about it all, and if at any time you feel uncomfortable having your pelvic floor assessed, there's never any questions asked. You can always just let us know and we'll stop the exam straight away. I would say almost 100% of our clients will experience absolutely no discomfort during a pelvic floor examination. Of course, it's an internal exam, so it's not the most pleasurable thing to be having done, but it's in no way painful or traumatic at all. After we've assessed your pelvic floor function when you're lying down, we then want to have a look at how effectively you can use your pelvic floor in sitting but also in standing, and then onwards from there when you're actually moving, and we can go into sport-specific activities, what you need to be doing on your day-to-day life, what sport, what exercise you would like to be doing, and we make sure that you know how to use your pelvic floor and core or deep motion system effectively during these times, so that when you actually leave our clinic, you don't feel like you fall apart, because you need to learn how to actually use your pelvic floor not only when you're lying down to be able to isolate those muscles effectively, but also during movement and when you're standing and getting around in your everyday life.